Mental health in America. 1 in 5 kids struggles with a mental health disorder. Anxiety, depression, suicide, attention problems are all on the rise. And millions of American kids are suffering in silence. 50% of kids with a mental health challenge go completely undetected until much later, even into adulthood. The CDC estimates a 10-year delay between when kids first show symptoms until when they receive treatment today. Meet Brady. He's your average 9-year-old kid. He and his mom go to the annual pediatrician checkup. And in that visit, it's only 15 minutes long, and his doctor has a lot to do. He checks Brady's vaccines are up to date and that developmental milestones are being met. Behavioral health simply isn't a priority. And Brady's physician doesn't have the tools or techniques to be able to understand if behavioral health challenges are present, unless Brady or his mom verbalizes something. So Brady and his mom leave the visit, and Brady continues to suffer in silence, with anxiety attacks and bullying at school, and it seems like no one's noticing. Imagine instead an alternate reality, where Brady's physician is empowered and knows how to detect behavioral health issues and has the tools to intervene right now in that visit. I'm Hannah Colin, co-founder of B-Vitals. B-Vitals is a HIPAA-compliant online assessment tool that empowers pediatricians to incorporate behavioral health as part of the standard visit. Our team brings together years of dedicated clinical expertise. B-Vitals was developed out of my mom, Dr. Besner's clinical psychology practice, where she sees kids like Brady every single day. My personal and professional background are focused in management consulting, where I've worked across the healthcare landscape and in health policy. Together, we want to help more kids and help them sooner. So how does it work? B-Vitals is like having a digital psychologist right at the bedside of care for the physician. And it's just 3 simple steps. Parents complete an online assessment at home before going for their checkup, and a report is automatically generated and loaded into the patient's electronic medical record at the doctor's office. The clinician report gives a very quick snapshot across 11 holistic behavioral areas and lets them know if there's any severe or moderate concerns they should address. And third, we provide a tailored action plan for each child so that doctors and families together know exactly how they can intervene on these challenges. Our physician users love us, and they cite 3 core ways in which we're helping make their jobs easier. Our proprietary algorithm combines multiple disparate assessments into just one simple digital screening tool. That means physicians only need to run 1 assessment to screen for things like depression, anxiety, and ADHD, rather than 3 distinct paper-based reports at their office. Our report is very simple and easy to interpret. It allows the doctor to make the most efficient use of their time and get right to the concern areas. And most importantly, B-Vitals is the only behavioral health assessment tool that also includes recommendations. This means doctors and parents can work together to know exactly what they can work on and use evidence-based recommendations going forward. If clinical and operational benefits aren't enough, this also generates new revenue for the physicians themselves. B-Vitals is reimbursable under Medicaid and private insurers, with the lowest rate being $50 per assessment, ranging up to $120 per assessment in new reimbursement. This means pediatricians stand to gain $1,900 in new revenue each month. Our traction to date is already helping kids, and Brady is a real patient that we've worked with. We have 5 pediatricians currently using our tool, and they've seen over 1,000 kids and teens with our assessment. We're in talks with 2 pediatric groups that would pilot our tool this summer with their 20 physicians and over 1,000 kids seen each month. We believe this market is grossly underserved, but it represents a huge opportunity. We're currently focused on the pediatric group and specifically the independent, privately owned pediatric groups. But with time, we hope to become the standard of care for mental health and kids. And that means we can scale this to anywhere where kids are served, including school counselors and other mental health or social worker departments. Doing a bottoms-up analysis explains how we'll get to this market. Our revenue model is based on a $100 monthly subscription fee per physician and a $10 per use fee collected each time there's reimbursement. What this means is with one physician, we have $600 of recurring monthly revenue, and that scales really quickly across the practice to $2,100 just for one practice. Over time, as we acquire more and more group practices, this leads us to a $360 million annual recurring revenue model. And again, this is just pediatricians in private practices and will scale beyond this with time. We think we can hit this target within the first 3 years. To date, we've invested $100,000 of our own founder money to get our operational HIPAA compliant platform up and running and launch a beta pilot test with our initial users. We're fundraising $150,000 today in order to launch a clinical research study to clinically validate our tool, which will enable us to scale much quicker and acquire more practices. If ever mental health and kids was important, the realities of COVID remind us that this is something we need to act on today. Our kids are suffering a lot right now, and there's so much more we can do to help. Early detection is ever more important today. And we believe B-Vitals is a solution that can help right now and can meet physicians in their current telemedicine realities and help improve their patient care as well. So join us as we make mental health parity a reality in America, one standard checkup at a time. Because behavioral vital signs should be just as important as your physical vital signs. Thank you.